The definition of foster care, being able to create a safer environment and life for children. Foster care is a process of having children brought into foster homes and families for temporary care from their current home or family until a more permanent arrangement has been made. These arrangements can be made by government officials and also social service agencies. Abuse in foster homes themselves is an issue that affects many children in today's foster care system. Causes for maltreatment can include poor living standards and living environments, substance and or drug abuse used by parents or surrounding family members. Some effects of abuse on children. They eventually have future abuse in their own homes and or emotional trauma they suffer from for the rest of their life and or for short periods of time. Living standards are important for children in the foster care system. Regulations and standards are often not met or encouraged enough in foster homes. An article written by Nina Behal, Maltreatment in Foster Care Review of the Evidence, states it is important to distinguish allegations of maltreatment from those concerning poor standards of care. However, the boundary between the two may sometimes be unclear. Poor assessment and supervision of foster carers may increase the risk of maltreatment. Regulations and standards are often not met. This can be living inspections and management, along with any other things that are required in order to create a safe living environment for foster children. In the year 2017 alone, there have been 4.1 million cases of maltreatment and abuse through the U.S. in foster care systems. According to Children's Rights, Child Abuse and Neglect, sibling relationships are by far one of the most essential factors in foster care. However, many times families are divided and split, leaving children to face the consequences of emotional trauma. An article written by Dave Williams, Grief, Loss, and Separation, states, findings suggest that biological children, birth children, experience grief and loss when foster children leave their families. This suggests that not only are foster children the ones who are affected, but also biological children who are living within the home as well. Emotional impacts that take their toll on foster children are related to how situations are handled individually. Many times children become distant and or aggressive in their childhood days after becoming separated from a very close sibling and or family member. Armeda Stevenson Wojciech's article and research suggests that emotional trauma and or other behavioral issues do come out of sibling separations. Many times children become antisocial and or aggressive towards other children because they have lost that essential connection with their biological sibling. Many times, as foster children become adults, these children include those who have been involved in the system firsthand or are birth children of foster parents who have cared for foster children for many years. They tend to suffer emotional damage because of the separation from siblings, whether biological or foster siblings. They tend to avoid foster care systems as adults, and they remain emotionally traumatized and or damaged as they continue in their adult life.